Alcohol use disorder, more commonly known as alcoholism, is a widespread phenomenon that has been extensively seen through many generations. But what some may not know is that this disorder is far more prevalent in younger generations than previously conceived. It is estimated that 15.7 million people within the US struggle with alcohol use disorder, and of those 15.7 million, roughly 627,000 of them are between the ages of 12 to 17 years old. Even more frightening is that another study by the National Institute of Alcohol Abuse and Alcoholism has found that as much as 15% of all populations of college students meet the basic criteria for AUD. It is clearly evident that this disorder has become a household name, and for all of the wrong reasons. But despite being such a commonly recognized disorder, there is very little being done for those who are suffering from the condition, especially those from younger generations. Sources that are being offered to older, more mature alcoholic drinkers are not nearly as advertised or presented to their younger counterparts. Why is it that someone's age must play a factor to be properly presented the tools to help cope with their addiction? Shouldn't we want to stop the cycle of abuse before it gets too far? It doesn't make sense that we should be solely focusing our treatment of AUD and long-term addicts. Because after all, how can we expect the cycle to end when we are exploiting and oppressing those who need help the most? The effects of AUD are only further magnified when the age of onset for drinking becomes lower. Adolescents who find themselves recreationally consuming alcohol regularly in their lives between the ages of 11 to 15 are 4 times more likely to develop alcohol use disorder in their late teens or early 20s. Those who come from white or Hispanic backgrounds also report higher incidences of AUD in teens and young adults versus African American or Asian communities. This risk is only further multiplied when coupled with behavioral and emotional problems, like antisocial and aggressive personality traits that can be exaggerated through alcohol abuse. Not only can AUD further aggravate emotional problems in adolescents, it can also cause irreversible physical damage to their maturing brains. A study from the Oklahoma Family Health Patterns Project found that drinking excessively at an early age can lead to both the amygdala and hippocampus in the brain to decrease in size, function, and growth. Both of these critical components in the brain are key to being able to appropriately respond to potentially dangerous, risky, or impulsive decision-making. This damage to the brain only further sets back these adolescents, as once they are fully matured, they will not be able to make the same healthy and logical decisions as others. In turn, this can lead them down unhealthy life paths as they lack the ability to be able to rationale their choices, which can include their ability to manage their alcohol abuse. The early damage caused to the brain only perpetuates the cycle further and makes it even harder for them to cope than those who develop AUD later on in their lives. Something that can be done to help prevent such life-altering habits from forming can occur through a few different ways. Perhaps best at preventing the whole disorder from occurring in the first place is having parents educate their children about the truths of alcohol and ensuring that their child feels comfortable coming to them about such a sensitive issue starting at a young age. This ensures that the topic is comfortable for both sides of the party to freely talk about and gives the child a positive authority figure in their life that they feel safe going to talk about such issues. This is something that everyone can do and does not require many outside sources to be brought in. Outside of the home, programs that are involved in educating children in schools can be used when coupled with the theory of triadic influence. This theory recognizes and breaks down how ultimate, distal, and proximate influence all can trigger a teen or young adult to develop AUD through external influences. When both of these methods of educating the youth are used, it can hopefully prevent future young generations from falling victim to such a preventable disorder. We are so quick to judge others and tell them their problems would all go away if all they did was stop drinking, but it ignores the fact that alcoholism often starts because a person is trying to run away from something or make themselves feel better. It is not because they are lazy, selfish, or looking for an easy way out. They simply have nowhere else to turn to. If we are able to combat this disease before it progresses too far in a person's life, then there may be hope that someday we can break the seemingly endless cycle of alcohol addiction.